There we go. Okay, session's being recorded. Okay. Um, Today, what we're going to do is we're going to dig down into the core of the VMSG dashboard, which is operational planning. It's an operational planning and execution system. So what we're going to do is dig down into, remember the pyramid. We're going to review that a little bit here, and then we're going to get into each level of the pyramid and go through exactly what should be in there, and then show you like real examples from public health departments across the nation. At the end, what we're going to do is actually enter the plan. So remember the same plan we were talking about with the tobacco cessation. We're going to enter that in the system so I can show you how to do everything you need to know to be able to enter a plan. And then I'm going to forewarn you that there is a little bit of homework on this one, and that is to enter your own little operational plan and make it something fun if you want to. I'm going to take a trip to Vegas, or I'm going to chase mosquitoes around, or whatever you're going to do. We'll build that plan right into the system, and then we'll review it in our next session and send you a nice certificate that says, hey, I've completed operational planning. So let's go ahead and get started here. We'll bypass the horse today. So the pyramid, just to review, is the organization is your health department, Corpus Christi. The groups is the structure of your health department, plus the primary plan. So the plans you see in the bubbles up there are the Fab 6-pack of plans, and they're independent groups within themselves because they're very high-level plans. Each group has its own set of services and or initiatives. Services are ongoing things. Initiatives are future programs. So I would consider your program to be a service because it's been for quite some time, I imagine. Initiatives are if you were going to add something to it, so some other type of an insect or something like that, then it might be an initiative, a future program. Each of those has a set of high-level goals. And we're going to go into a lot more detail on this in a minute here. Each goal has a set of SMART objectives, and each SMART objective has a set of activities. Now, just kind of an FYI, and I don't know if I went over this before or not. The reason the pyramid makes sense here is if you take something like your strategic plan, the strategic plan is a group within itself. So under the group, then you're going to have what you would call your strategic initiatives for your strategic plan. Typically, there's somewhere between 3 and 7 of those, and we'll say it's for today is 4 of those. Each of those services or initiatives has a set of high-level goals, and we'll say there's 4 of those. And let's say each of those has 4 objectives, and each of the objective has 4 activities. I think if you do the math on that, it's 256 activities. So I think you can see how the pyramid gets pretty wide at the bottom here. Now, the nomenclature that you see here, the organization groups, et cetera, is kind of the industry standard. However, it's not cast in concrete. Some people go out and they want to make their own version of the plan. Typically, the model is the same, but the nomenclature can change. So I just wanted to give you some examples that we've seen of different names for the different levels of the pyramid here. So if somebody comes up and says, hey, Jeremy, put this plan in the VMSG dashboard, and the names don't match, you'll be able to kind of pretty much look at it and say, yeah, I can make that fit into the dashboard easily here. Let's look at some of those. Strategic priorities, what we call services or initiatives, and that's very typical with your strategic plan, obviously. Goals, at goals, strategies for objectives. Now, I'm not a big fan of strategies at the objective level because to me, a strategy is how are we going to get someplace? The objective is what are we trying to achieve? So it's kind of backwards there. So if you flip strategies and objectives in this model, I'll buy into it. Strategic areas is a pretty good definition of the service or initiative. Goals, outcome objectives, not bad. I kind of like that. What's the outcome we're trying to achieve? And then there we go, strategies at the bottom, which is not bad here. Priorities, goals, objectives, and action steps. Action steps is a very common term for activities. Priority areas, goals, again, strategies, I think in the wrong place here, and action steps. Priorities, goals, objectives, and strategies, good. Now we got strategies at the top, and then strategic objectives for goals, which I don't have a real problem with that. It's a higher level than an objective, than objectives and action steps. So again, I just want to show you, and then there's probably 100 other variations of this. I just want to show you some things that we've seen. So if somebody again hands you the plan and it says priority areas, you'll know that that's probably the service or initiative and things along that line. So let's go through each level of the pyramid and look at some examples here. So the groups, again, is the basic structure of the organization. So let me take you to your group screen here. So if I go up to the very top, your groups, the district is the highest level group. It's a level 1. So the levels go from 1 to 10. And not like I tell people, nobody's ever gotten past 5 or 6 to the best of my knowledge. It's a level 2 group over here, like your strategic plan, your CHIP, etc. Report to level 1. And then you get down here to accreditation, and then you see the FAB accreditation plan as a level 3. So you can get all the way down. Today, we're going to work down at the bottom here. So the training group, and then under the training group, as you can see, is Tobacco 2026 group that we'll be working on today. So the department is always your level 1 group, so it's the highest level. Underneath that, let's say we have a community health division. Community health division reports to the department, so we have what we call a parent group. The parent group for community health would be the department, and the level is always one level below its parent group. So if department's level 1, community health has a parent group of department, and it's a level 2. And under community health, we have WIC. So WIC is level 3, reporting to community health, which reports to the department. And then as you saw in your group screen, the high level plans, like your strategic plan, are typically level 2s. They don't have to be, by the way. Some people have a group under department called accreditation. And then under that group, they put the FAB 6-pack of plans. You can do it any way you want to. And by the way, these things can be moved around as needed, so it's not a big deal. This is just kind of how's our department laid out. Same thing with your community health improvement plan. It's level 2, reporting to the department. And then we're going to use the same example we've been using, Tobacco 2026. So it's going to be a level 2 group reporting, in our case, to the training group, but in a normal department, it would report up to the department level. So that's kind of what your groups look like. Services or initiatives. I like to call these buckets or containers. It's really not part of the plan itself, but it's the ultimate outcome we're trying to achieve with the plans underneath there. So here's, again, some examples. Healthy moms and babies. That's what we're trying to get to with all the plans and everything we're going to do underneath it to get to healthy mom babies. Readiness for emerging health threats. Effective agency processes. Access to care. Behavioral health and substance abuse. Population health. Organizational excellence. Chronic disease prevention and control, health disparities, and again, we'll use tobacco cessation as our example. So if you look at any of these things, they're really not a plan themselves, but what are we trying to achieve with the plans? And again, services are ongoing things. Initiatives are future programs. The only real difference is when you get down to reporting and things like that, it's a little bit different, but for the most part, they're identical through the system here. Underneath the service or initiative, we have the high-level goals. High-level goals is kind of a broad definition of what we're trying to accomplish. Typically, they're very simplistic, something like an action verb followed by a few words. So let me give you some examples. Reduce the risk of infectious disease. Promote safe and sanitary food establishments. Support communities in building resiliency. Enhance healthcare through technology. Drive health in all policy agendas, reduce the risk of vaccine-preventable diseases, promote public health readiness and response, promote succession planning and career growth, integrate a data-driven best practices approach, and then we're going to use the example of reduce smoking in high schools. So if I tell you we're going to reduce smoking in high schools, that's pretty obvious as to what we're trying to accomplish. What it doesn't tell us is where are we going to start, which high schools? How much do we think we can reduce smoking? By when are we planning on doing that? That's what the SMART objectives are about. And again, I think we talked about this before. There's probably 100 different definitions of the SMART nomenclature. Ours is pretty simple. Specific, measurable, attainable, realistic, and time-based. And I like to tell people, if it's not attainable, if it's not realistic, don't waste your time. Focus on specific, measurable, and time-based. Again, let's look at some examples here. By December 2026, identify 2 or more strategies to collaboratively reduce risky alcohol-related behaviors. So our strategies to reduce risky alcohol-related behaviors is the specific part. Our measurement is 2 or more, and our timeline is by December 2026. So it fits the model. By December 2026, 80% of educators and school staff have been exposed to ACE awareness education. By June 2026, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, all programs will have established goals, objectives, and activities to be reported on within the VMSG dashboard. And then we're going to reduce smoking at Wayne High School by 25% by the end of the school year. So when I tell you that's our SMART objective, you look at that and say, boy, that's good. That's what we want to do. What it doesn't tell you at all is how are we going to get there? And that's what the different activities are about. And again, a lot of people call them action steps because it's the steps we're going to go through to try to accomplish the objective. And as we talked about in the intro, there are 3 distinct types of activities. By far the most common one is your project-based activity. When we first designed the system, it was the only type in the system. And then over time, we've added the other types at the request of different health departments and things. But here's a project-based activity. Create training content and materials for students and faculty on the dangers of smoking. So what we're thinking about here is we're going to make some PowerPoints, we're going to make some user guides, we're going to make all the materials we need to go out to do the training. So it's a project. How do we know when we've successfully completed the project? That's what the performance measure is all about. Once the training content material has been created, we're done with the project. When are we going to do it? In this case, we're going to say January 1 through March 31st of 26. We're going to assign team members and a team lead, so who's responsible for doing it. If we're working with external partners, we can assign those folks as well. And then our measurement is going to be real simple, % complete. So if we're halfway done, we're 50% complete. If we're all the way done, we're 100% complete. So it's a real simple way to measure progress through here. Probably, again, about 85, 90% of what you put in the system will still be project-based activities. It's the most simple one. The QA activity, quality assurance activity, provide 9 training sessions each month on the dangers of smoking to students and faculty. So what this one does is unique is because it's cyclical. It's on a given frequency. So the frequency here is monthly. So in this case, that frequency set anywhere between weekly and every 5 years. We chose monthly in this case. And the other thing that this one does that's unique is most of the traffic lights, by the way, are a manual setting. There's a few differences in it, but for the most part, it's manual. This one is fully automatic. So you're gonna say, what if we get to our 9 training sessions or more? We're going to call it a green light. And then we're going to set a red light value, and we pick any number we want. We're going to say, if we only get to 6 or less, we're going to call it red. Then you can imagine 7 or 8 in between there would be yellow. So automatically sets a traffic light and repeats on a given frequency. Instead of a beginning and ending date like you had on a project-based activity, you got a cycle start date and a frequency. Now, every activity's got to have a beginning date and an ending date and a % complete to be able to calculate, are we on schedule or not? In this case, the ending date is calculated dynamically. So if we say the frequency is monthly and we begin on January 1, then obviously it's going to calculate the ending date to be January 31st. And then it's going to automatically move you into February. So you got February 1 through February 28th as you're moving through there. Your performance measure is kind of somewhat created for you. I'll show you how that happens in a minute here. Training sessions provided, measured monthly, green, yellow, and red. And then we're going to assign a team of people. We're going to assign external partners if we're working with them. As you can imagine, our measurement is pretty simple. How many training sessions did we provide during the month here? So the QA activity, by the way, is the least used type of activity because it's always got to be something that's over and over, measuring on a given frequency, and you want the traffic light to be set automatically on this one. The third type, and the second most common one, is the quantitative measurement activity. Contact all 20 tobacco vendors within a mile of Wayne High School to ensure they're not selling to minors. Very, very similar to the project-based activity with the one exception, and that is that we have a target quantity. So the reason that you have the target quantity is just because it makes it easier to calculate how far along we are. So if we're saying we're going to contact 20 tobacco vendors, once we contact 10 of them, it's going to calculate 10 divided by 20 and say we're 50% done. Contact 20 of them, it's going to say we're 100% done. So this calculates that. And by the way, there's tons and tons of things that you guys count in public health. So it makes it real nice to be able to track these things. We're going to have beginning and ending dates, just like the project-based activity. Our performance measure, again, is somewhat created for you. 20 tobacco vendors contacted me January 1 and June 30th. And then again, we're going to do the team assignments, and if necessary, the external partner assignments. And our measurement in this case, as you can imagine, is how many tobacco vendors did we contact. So again, it's going to calculate during the time that we're doing this. We're going to calculate, hey, we did 15 of them, so we're 75% done. So those are the 3 types of activities. Now, if I take everything that was at the bottom of the screens in blue and the activities and put them into a kind of a bullet form, it looks like this. So our group was tobacco programs for 2026. Underneath that, we had multiple services and initiatives. We chose tobacco cessation. Under that, we could have had multiple goals. We chose reduce smoking in high schools. Under that, we had SMART objectives. In our case, reduce smoking at Wayne High School by 25% by the end of the school year. And then we had the activities: create the training content, provide training sessions, contact tobacco vendors. Now, this is called a segment of an operational plan. Segments can repeat at any level. So you could have groups and subgroups. So you might have some other tobacco programs or something underneath that group as a subgroup to it. You can have multiple initiatives, tobacco cessation being one of them. You could have ones that you're planning out. You could have reduce smoking in high schools. Let's say we had another goal called reduce smoking in colleges. Now, underneath that, we're going to have its own SMART objective, which would be reduce smoking at my other alma mater, Wright State University in lovely Dayton, Ohio, by 25% by the end of the school year. And then you're probably going to have a similar set of activities underneath that. So like we talked about, these things can repeat, and you can imagine you can get lots and lots of activities down at the bottom down there. So you get that pyramid being really wide. Now, attached to the meeting invitation we sent out is a copy of this operational plan, a blank copy, basically. This was actually created by one of our health departments up in Wisconsin, and they did it as they were just rolling out the system to get people used to developing the operational plan before they put it in the system. And then at some point in time, they just eliminated this and went straight into the system. But it's really kind of cool. What it is just a big Word document with a bunch of tables on it. But it's kind of nice because it lays out what are I looking for. So under service and initiative here, you can see what bucket of work or priority does this relate to? Tobacco cessation. Our first goal: what is your pie in the sky, your high-level goal? Reduce smoking in high schools. Our SMART objectives, specifically, what and when do you hope to accomplish? And it gives you the objectives. The objective leads: who's going to lead the charge? Who's responsible for getting to the target on the objective? Our activities: what are the steps you'll do to accomplish the objective? Performance metrics: how will I know when I've successfully completed the activity? Activities: who's primarily responsible to do and update this activity? So that's the tool. And what we're going to do now is we're going to take this plan and we're going to enter it into the system. I can show you all the different clicks and all the different variations of the activities and things like that. So let me get to the real plan here. Okay, so this is the document. And again, you got to copy this. If you didn't get the copy, just let me know.
No, I have a copy of that.
Okay, great. Okay, so what I'm going to do is I'm going to grab tobacco cessation here. I can right click and copy. I like keyboard shortcuts personally. Control C is copy.
Mm-hmm.
I'm going to go back over to, let's go back to system here. Okay. So again, I'm going to go down to our tobacco 2026 group. Because I've selected the group, when I select services or initiatives, it's going to be within that group. So there should be nothing in there. Well, okay, we have the old tobacco cessation one we did yesterday. And just FYI, you see it's grayed out. The reason for that is because this hide service checkbox down here. What that does is basically archive it. So most users, unless they're a manager level or an org admin level user, won't even be able to see it. If you're a manager or org admin, you can report on it. You can do all kinds of things. But it just kind of takes it out of the limelight. Maybe this was last year's tobacco cessation program. So we're going to go ahead and add a new one in here. So I'm going to hit the plus button here. Plus button, just kind of an FYI. Everything down in the blue is done on your local computer. So it's not going back and forth to the server, so it's very quick. Once I hit the save button over here, the disk, it moves up to the server. So it's a very efficient way to do multi-user computing. We have 4,600 users, I think, on the system. So you want everybody to just be doing it for the milliseconds when they save it. So I'm going to hit the plus button here, and Control V is paste. So I'm going to use Control V, and let's just call this Tobacco Cessation 2. And I'm going to go ahead and save it. Now, this checkbox up here is the difference between a service and an initiative. If it's checked, it's an initiative. If it's unchecked, it's a service. And again, it doesn't make a lot of difference other than in the reporting. And when you get to the activities, the initiatives have future dates versus current dates, that sort of thing. But for the most part, it's just going to be pretty much identical going to the path there. So that is our initiative. So let's go back to our document here. So the first goal here, reduce smoking in high school. So I'm going to grab that. Again, Control C, go back over to here. Now, because I've selected tobacco cessation 2, when I go to the goals tab, it's going to be everything just for tobacco cessation 2. So I'm drilling down. Now, because we haven't put anything in here yet, we have this big block. So it won't let you do anything until you add a new record. So it's either this big block is the plus button or this little plus button is the plus button. They're both identical. So I click on that. Again, Control V to reduce smoking in high schools, and I'll go ahead and save it. And let's go back here, and we have some other goals down here. Reduce smoking in colleges. So let's grab that. Control C, go back over to here. Again, hit the plus button, adds a new record, clears out everything at the bottom. Control V, save that. So we got that one. Let's go back. I think we have a third one down here. Reduce smoking in public areas. Control C. Go back over to here. We'll hit the plus button. Control V and save that. Now at this point in time, goals, objectives, and activities have traffic lights assigned. If I wanted to change the traffic light, I can either cycle through them with my mouse just by clicking here. So you got the gold bar, the 100%, red, yellow, and green. I can also use this little drop down. So I can just select the one I want. Some people like it either way, so we put both of them in there for them here. We'll go ahead and leave it at green, and we'll go ahead and save it. So again, the goal is our high-level goal, what we're trying to do. I've selected reduce smoking in high school, so when I go to objectives, it's going to be the objectives for reduce smoking in high schools. Now, you may notice these little drill down arrows over here. Is all this does is save you a mouse click. So if I'm down here at reduce smoking in public areas, and I want to add objectives for goal 1, I can either select goal 1 and then hit the objectives tab, or I can just use this drill down arrow. And what it'll do is do exactly that. It'll select goal 1, and it'll take me to objectives. I'll click on that, and there we are. Is all it does is save you a mouse click. But if you got lots and lots and lots of different objectives in there, or at any level, it'll do the same thing. It just makes it easier to do it, easier to navigate. Okay, so I'm down at my objective level. I'm going to click here to add the new objective. I'll go back over to here, scroll back up to the top. Our objective, reduce smoking at Wayne High School. So I'll grab that. Again, Control C, back over to here, Control V, and we'll go ahead and save that. And so you see it appears up here. Now this is everything up at the top is up on the server, so you're looking at a mirror image of the server. The next thing we're going to want to do is decide what are we measuring at this level. So you see this down here. The default is objective percent done, which would be 0 to 100%. If I change that, so we're measuring percent reduction. So I'm going to change that, and I'm going to change this to percent. And just FYI, there's a character limit just because they have to fit down here of about 19 characters, and you're putting it in there. So percent reduction fits. Measurement units is what appears after the fact. So we're saying percent reduction. I can say decimal or percent. Decimal is anything you're counting. Percent is obviously that percent. So I'm going to say percent. So now you see it change down here to percent reduction, and we're at 0%. I'm going to go ahead and say we're at 20% now. And I'll go ahead and save that. Now, anytime I make a change down here and the traffic light is not set automatically, which is most of them, it's going to ask you, is the traffic light correct based on your update? Now, you look at this particular one, and our target is 25%. And right now we're only at 20%. We could say, we're at the end of the cycle and it's not there. We can maybe mark it as yellow. Or we could say we're on the way. We're on our climb to get to 25%. So we're still on track. So we'll just leave it at green. It's just a reminder is all it is. Okay. The next thing we're going to do is assign a person to here who's going to be our objective lead. So you hit the drop down. The reason nobody shows up in here is because it's looking at the current group selected. Our current group selected is a training group, and nobody's assigned to that group. So I just say show all users up here. I was looking for where's your name in here?
Yeah, you look like at the very top.
Oh, I don't know why I started at the bottom. Okay. So we're going to assign you as the objective lead. So I click on your name and hit the save button down here. So you notice you appear down here. And again, it's not at the server yet until I hit the save button. So you notice the objective leader is blank up at the top. I hit the save button and poof, there you are up there.
Hmm.
So now this is the objective we've set up in here. Now, anytime you make a change over here, the percent or the traffic light or anything, you might want to put a note over here. And the notes is just an ongoing dialogue about what happened in this one. So anybody else can go back and look at it and say, oh, I see why he changed that light to a yellow. A couple of options you have down here. Number one is this is a note. So you can just type in a note if you want to. Or you can add a date, time, and user stamp to the note by clicking on the little button right here, little calendar. So it says 4/8/2006 at 9:33 a.m. System admin, or it would normally say Fred Erickson, added a note that says currently at 20% reduction. And I'll go ahead and save that. Okay. Now, this little guy right here was just created for your friends over at San Antonio. They've been using the system for many, many years and have tons and tons of notes. And this is a kind of a limited way to look at notes. It'll scroll forever. There's a little scroll bar over here. It'll scroll down forever. However, if you want to look at all notes on one page, they just wanted a bigger window. So it's created this window here. Mm-hmm. It's exactly identical to what's in this field down here, just in a bigger view. You still got the date and timestamp button up here, got the save button down here, but other than that, it's identical. So it's just kind of a nice little feature if you got lots and lots of notes in there over time. The next thing you might want to do is say, where are we going to get this data from each time I go to update it? Now, typically the update cycle is set for monthly. So maybe by the end of the month, you forgot where you went to get the data for Wayne High School. So you can put a data source in here. So clicking on this guy right here, we're going to say we're getting it from the CDC Smoking Cessation Fast Facts webpage. That's just a description up there. Now, what I do when I put the link in here is I have to put a qualifier in, and that is like HTTP : / could be HTTPS for secure. It could be FTP for file transfer. Could be anywhere on the internet. It could be on your intranet. It could be in your file servers. Any place that you have that data available, let's put a link to it so you can get to it immediately when you go there. Typically, what you're going to do is, if I wanted to navigate to this web page, there is such a thing out there. I can click on a new browser tab, navigate to the CDC Smoking Cessation Fast Facts web page, and then click right here to grab that link. Copy it, Control-C, and then paste it down in here. In this case, because I don't have the whole link, I'm just going to put it at the CDC webpage, www.cdc.gov, and I'll go ahead and save it. Now, you notice down here that the description appears in here, and this little link button shows up. I'm going to go ahead and save this again. The link button should open a new browser tab and take you right to the CDC website. So let's see if that works. And poof, presto, changeo, it works. Okay. So the idea here is if you've got a place that you can go to get that data, let's put it in the data source. And by the way, the data source can be at the goal level, the objective level, or the activity level. So you can have separate data sources for everything. Just makes it easier to do your updates in here. So that's pretty much everything at the objective level. Let's go on down now.
Yeah, Fred, real quick, just real quick. The status, what little icon did you click to get to status, to enter the status?
Just right down here at the bottom left.
I don't see the cursor that you're pointing at.
Down below the reduce smoking at Wayne High School. Maybe can you scroll your screen up a little bit, maybe?
Oh, that's my screen.
Yeah, I've seen that happen many a time.
Okay, got it. Okay. So sorry, I was like, you kept saying bottom left. I was like, I don't see it.
It doesn't exist. It doesn't exist. No.
Yeah. Okay. I got it.
Yeah. So that's where you're going to do your up down there. Your current percent done, and again, hopefully you'll get it from your data source page. Okay. So now what we're saying, reduce smoking Wayne High School by 25% by the end of the school year is our target. The question is, how are we going to get there? So that's what the activities are all about. So I'm going to go down to my activity screen and again, put my first activity, open it up, go back to the plan. So I have the 3 different types of activities here. So I'll put them in there and go over detail on each of them. Create training content, Control C, back to here, Control V. Now, the performance metric. For a project-based activity, it's a complete manual process here. And I just happen to have one right here, training content and materials being created. So once they're created, we know we're done with the activity. Control C, back to here, paste it in there, Control V. When are we going to do it? Beginning and ending date. So I'll go ahead and say it's April 1st through April 30th is our dates. By the way, you can just type the dates in there if you want to. I typically use a little calendar. It's just easier. Our percent complete. So right now, let's just say we're 50% complete doing the training content. So I'm going to go ahead and save that. So basically what we've entered is the activity, the performance metric, when are we going to do it, and how far along are we? The next thing we're going to do then is going to enter the activity teams in here. So to do that, this little pencil icon is going to open up the window for activity teams. And again, nobody's in this window because we're in the training group. So to clear that, I just hit the little black X, any one of the 3 up here at the top, clears the filters. So right now it says we're in a training group. I'm going to clear the filter. Now it's gone to the whole department here. So you got 3 columns: team member, team lead, email notification. For you, I'm going to go ahead and click the team lead. And you'll notice that it makes you a team member automatically. You got to be the team member to be a team lead. And you're the person who's going to get that email to do the update on this thing. Mm-hmm. And then let's just go ahead and click Blandina, I think, and Catherine as team members. And when I save it, they appear down here. So the L indicates team lead, the T indicates team member, and the blue around the L indicates email notification. So you are going to get an email to update the status of this particular activity. Now, the other thing we can do, and you guys, I don't believe have any partners in there yet, you can add external partners. So if I click on this, you're going to have a list on the left side of partner organizations. You may remember from our intro, we had VMSG dashboard in there. And when I click on a partner organization, if we've entered contacts for that within that organization, they'll appear over here. And it'll be a little check mark on the left. I can have as many partners selected, and within each partner, I can have as many contacts, 0 or as many contacts as you want. It could be the whole organization I'm selecting, or it could be just a specific contact within the organization. And then again, I would save it and I'd be all set to go here. The little wizard button you see here, every activity's got its own little wizard. So in this particular case, I'm going to click the wizard, enter the beginning and ending date. I can do it either, doesn't matter. Data entry type. The default is 0 to 100%. As you can see over here, we got 50% in there. I do have a couple of other options. So let's say I'm going to go out and create this training content this week, and on Friday, I just want to go in and say I'm done. So I can just do this and say mark it complete. And you notice when I do that, you get, instead of an entry box, you get a checkbox over here, complete. And if I click the checkbox, that means it's 100% done. So the field is 0 to 100%. I can put anything in there. When you got the complete, it's either 0 unchecked or 100% checked. Mm-hmm. And you may notice over here that the traffic light turned to a gold bar when you got to 100%. So that's one of the few automations on the traffic lights, because you can say, hey, we're done. We're going to mark it as a gold bar. Now, you can go in and change this on this particular type of activity. You can override it if you want to, but typically it's going to stay right there. And there is one other option, and that is yes, no. If I do that, instead of a field or complete, it's just saying if this activity happened to be phrased as a question, like, have you completed the training content yet? You can mark it as yes or no. Yes is 100%, no is 0%. Let's go back and set that back to default here. Maybe. Okay, 0 to 100%. And yeah, that's pretty much everything you need to know. Again, you see the data source down here. You can add a data source. Got notes and comments, time and date stamp, the whole 9 yards here. Go ahead and save that again. And because I changed the value over here, it's saying, is the traffic light set correctly? I can say, okay, and I can go change it if I want to, or I can just leave it as is. So that's activity number 1. Let's go grab activity number 2, which is our QA activity. Provide 9 training sessions. Control C. Back over here. Again, I'm hit the plus button to open it up. Control V, provided 9 training sessions. This is our activity type. So I'm going to go ahead and drop down to QA, and you'll notice that it opens the wizard automatically. So what's our frequency? Training sessions each month. So I'm going to go ahead and select monthly. So you notice all the different ones, anywhere between weekly and every 5 years. So I'm going to go ahead and select monthly on this one. Beginning date, let's go ahead and set it for the 1st of April. Timeline, I'm going to talk about in a few minutes here. It's a variation of this type of activity. I'll show you why. So I have green, yellow, and red values. So the yellow is calculated. The green, in this we're going to say, is if we get to our target of 9, it'll light to green. And we're going to say if we only get to 6, we're going to call it red. You can put anything you want in there. And you'll notice it calculates greater than 6 or less than 9 to be yellow. So 7 or 8 is yellow. I do put in a metric type. In this case, it's going to be training sessions provided. And when I save that, it builds the performance metric for me. Training sessions provided, measured monthly, green, yellow, and red. Now you may see that the traffic light up here is red already. The reason is because there's nothing in here, which equates to 0, which is less than 6, so sets it to red. If I went ahead and made this 8 and click off of it, you'll notice it turns to yellow. So 6, but greater than 6 and less than 9, 8 turns light to yellow. So just shows that the light is set automatically here. We'll go ahead and save this guy. And we'll look at some of the options on this one here. So up here is our wizard for this particular activity type, a little bit different. So we got our frequency here, our start date. One of the things that you can do, sometimes less is better. So I think of the idea of a golf score or mosquitoes, less is better. So in this particular case, if I wanted to say if it's less than a certain number, I can click the greater than equal to, click it to less than or equal to, and I can say if it's less than 3, it's going to be green, and if it's greater than 6, it's going to be red. So what it does is just reverse the logic on there if you want to in that particular case. So let's go ahead and set it back to 9, and we're already 6. And by the way, when I click this button, it clears them because you can't have the wrong value in the wrong place, so it automatically takes care of that for you. Greater than 9 and less than 6. And that is pretty much the options for the QA activity. We'll save it again. Now, when I update a QA activity, because it's cyclical and I'm doing it in certain frequencies, like monthly in this case, it's going to say, do you want to update the cycle start date? So right now it's 4/1 of 26. And let's say 8 is all I'm going to get to for this month. So I say, yeah, I want to update it. If I said no, it's going to just leave it here. If I say current, it's going to put, 4/7 or whatever it is today in there. Select is the most common option, though, because it's going to automatically move it ahead by a month to 5/1 of 26. I can, however, edit this if I want to. So if I wanted to make it 5/15, I could do that. But let's leave it at 5/1. I'll hit OK. And then what it's going to do is says, do you want to reset the actual number to 0? So this 8 was for the previous month, so the month of April. So I'm going to be measuring into May now. So I'm going to go ahead and say yes. So now what it does is it moved that on, because I've saved it before, it moved it on down to the running total in here and has the actual number up in here. So it basically is ready for the next month. You can see the start date moved up by a month here. And I think that's all the different options for the QA activity. Let's go grab our third activity here, which is the quantitative measurement one. Contact all 20 tobacco vendors. Control C. Again, we'll hit the plus button to add it. Control V. Hit the drop down to select quantitative measurement. Again, a new wizard. I'm going to go ahead and say April 1 through April 30th again. Target number we see is 20, so we'll put that in there. Decimal or dollars. Decimal is anything we're counting that's not dollars, if that makes sense. So whatever you're counting is not dollars. Dollars just puts dollar signs in 2 decimal places there. Our metric type in here is going to be tobacco vendors contacted. And then down here, 2 options. Enter a value to add to total. So it's a running total here. I'll go ahead and leave that in there for now. So now we have our add to value down here. So let's say we did, let me go ahead and save that. And I'm going to say, okay, we did 5 contacts this week. So I'm going to go here and put in the 5. And when I click off of it, it's going to run 5 down to the running total, calculate it to be 25. So 5 divided by 20 is 25. And I can go ahead and save that. Now, is the traffic light, again, because I did an update on it, is the traffic light okay? I'm going to say, yeah, we're moving along. We're in the first week of the month or whatever, so we're good to go. I'm going to go ahead and leave it at green. The next time, maybe I go in next week and do another 5. It rose it up to 10 running total and calculates to be 50% done. So that is your one option here. Now let's go back to the wizard here. You saw the decimal dollars that showed you that. Enter a new total value. This is just if you're going to go in like at the end of the month and say, I contacted all 20 tobacco vendors. I save that. You notice the running total goes away and it brings the current running total up to the actual value. So I could go in here and say, at the end of the week, I put in 20 and save it and we're all done. It'll calculate to be 100%. And there is one other option in here. Let me save that while we're there. One other option on the wizard, and it's kind of hidden. There are sometimes things where you don't have a target number. How many vaccinations did we do this month? How many medications did we distribute this month? You don't have a target number, but you want to know at the end of the month. So we call this a zero target. So if I have a zero target, and let's back to enter a value to add the total here and save that. So what you'll notice is that the percent calculation went away. The reason is you can't divide by 0. So what it's doing is just keeping up. Maybe I go in every week and say how many vendors I contacted because I don't have a total. I don't know how many there are out there, maybe. So I can just go in here and put in a new number, 5 more vendors, and it's just going to roll up the total, the running total. At the end of the month, I can go in and say, hey, we did 15 of the 20 vendors out there. We're good to go. I think it's all of the different options. Yes, that is. Okay, so that's all the different options for this particular activity here. Okay, now let's go look at the plan we just entered back into the pyramid, just kind of as a reference here. Okay, so our group was Tobacco 2026. Our initiative was tobacco cessation. One of the goals was reduce smoking in high schools. Our SMART objective, reduce smoking at Wayne High School by 25% by the end of the school year. And then the steps we're going to go through to get there. Now, there's one other activity I want to put in here, and it has nothing to do with this plan, but I wanted to show you the timeline activity here. So let's go back to here. Like I say, it's not going to have anything to do with this plan, but I just want to put it in there so you can see it. So I'm going to hit the plus button here, and I'm going to say, and this was actually created to be able to manage critical documents over time. One of our Michigan health departments requested this because they have a bunch of standard operating procedures that they have committed to update every fiscal year. So let's say we're going to update SOP, Standard Operating Procedure 1, each fiscal year. So we're updating the SOP each fiscal year. We're going to call it a timeline activity. So it's a QA activity, and I hit the timeline checkbox here. The timeline says percent to yellow. So I'm going to put down here in the metric type, update SOP1. I'm going to put in here 90% of the way through the year is what I'm telling it. So if we have, and the frequency is going to be annual. Okay, so what I've done, and I want to set the beginning date at the beginning of the fiscal year, July 1. Okay, so July 1, when we get to 90% of the way through the year, which would be about mid-May of next year, the light is going to turn yellow. So right now you can see the performance metric, update SOP1, measured annually. If it's, the light's going to stay green if it's less than 90% of the way through the year. Once you get to 90%, the light turns yellow. When the light turns yellow, let me go ahead and save this. And I'll go ahead and clear this out and add you as the team lead. Save that. Okay, so now what's going to happen? Let's say we have a specific SOP document. This is document management right here. You can see documents anywhere in the system with this little blue folder. I'm going to go ahead and add a document here. So I'll click on the add button, choose a file. I'm just going to pick a random file off my hard drive here. Eventually. Okay, I'll just say, oops, 3D planning syllabus, we'll call that SOP1. Then when it shows up there, I'm going to go ahead and upload it. It's being very slow today. Okay, so now you can see that the document is attached over here. I'm going to call this SOP1. I can set the traffic light to whatever I want. I'll go ahead and say it's green for now. I can put notes in here. I can time and date stamp the notes, everything I want to do. I'll go ahead and save this. So now we have the document attached to that particular activity. Here's what's going to happen. About mid-May of next year, when the light turns yellow, then you're going to get notified with the real-time planning email. It's going to have a link in it right back to this activity. You're probably going to come in here, click on here, download the current document, do the updates for the year, upload the new version. It'll do automatic version control for you. Just upload it just like I showed you there. You're going to go get the new version up there. You can hit the save button. It's going to do just what we showed you on the other QA activity. It's going to say, hey, do you want to move the date ahead? You can say no. You can say today's date, or you can say select a date, which would be 7/1 of 27 probably would be the new date. And then away you go. And that's what it's going to look like. For now, I'll just say no. So that's the timeline. And again, where this is cool is when you're doing critical document management. So policies, anything that has to be updated on a regular time frame, no matter what that is, you can set the frequency to monthly, quarterly, annually, 5 years, whatever it happens to be in there. Okay, so homework, real simple. We're just going to walk you through exactly what you need to do. So the first thing you do is log in and select the groups tab. So we'll go back to there, select groups, and you're going to scroll down to the training group down at the bottom here. And select the training group, select services or initiatives tab. So under training, you're going to go service or initiative. Nobody from the other course did their homework yet, so you might be the first one.
Okay.
Now hit the plus button to add your service or initiative, just like we did before. And it's going to end up looking like this. So under the training group, you're going to have a service. I'm going to use the example, birthday party for Billy. Billy happened to be my son. My goal would be to have the best birthday party ever. My SMART objective, by the end of January, select an appropriate venue for the party, and then a couple of activities. Check with neighbors for venue suggestions. Check Yelp for potential venues, and you could have as many as you want. Ideally, it's going to be a simple plan like this. And if you want to have something fun with it, please do. If you want to do something business-like, please do. But just go in there and start out at the initiative level with something simple. Remember, what is the ultimate outcome we're trying to achieve? And then the first goal, how are we going to get there? Or what is the goal to have at this point? In this case, have the best birthday party ever is a great goal. And then how am I going to get there? By the end of January, select an appropriate venue. And then you can probably have some other objectives like contact Billy's friends to invite them to the party or something along that line. In an ideal world, you'll have one service or initiative, one goal, one SMART objective. And if you can figure out a way to use the 3 different types of activities, so some project-based activity in there, QA activity, something you're going to repeat, every month before the party, something like that maybe, and then a quantitative measurement activity. I'm going to invite 100 people, and then you can, count down as to how many people got in there. So whenever you get a chance to do this homework, it should take about 5 minutes, literally. It's a simple thing to do. Put that in there, and then what we'll do on our next get-together is we'll review your homework, make any suggestions, and I'll just give you up front. Where most people have trouble is in the SMART objective. So always remember, it's something very specific that you're doing. You're going to have a measurement. If they just say an appropriate venue, that's one venue, so that counts. And when are you going to do that? By the end of January, or by January 31st, or whatever it happens to be. That's where most people have trouble. And then the activities are just, how am I going to get that done? How am I going to select the venue in this particular case? So any questions on the homework?
No, other than the link to the site. I just use the regular the link that you guys had sent before,
Yeah,
right?
login.vmsgdashboard.com.
Yeah. Okay. And you said this is recorded. When I mean, are you going to email the recording or?
I will do that. Yes, I'm
Okay.
gonna start the recording and I'll send it over to Denzel, and then he'll be kind of the source for it.
Okay. Yeah. That's it.
Okay, sir. Well,
Okay.
that's all I had for today. And again, if you
Okay.
have any questions or you have any trouble getting in, doing anything, please feel free to email me or call me or whatever.
Okay. Appreciate it, sir.
Good to talk to you, Jeremy. Thank
Good
you.
talking to you.